My heart really breaks for the girls who are in college and already getting Botox. To be in your 20s and to be thinking about what you can do to be more beautiful, to be more accepted, is devastating to me.
The comments on this are hilarious. Too young for Botox, some might say. Are they image obsessed? Well, the other scenario is when you have someone come in and get Botox, but it's too late. Their lines are so etched in that Botox didn't eliminate their wrinkles. And it's really disappointing when that happens.
But if they had started Botox earlier, would it have worked?
Is preventative Botox a real thing? How young is too young for Botox? When is the best time to start Botox? And how often should you plan on getting it?
My name is Emily Dowe. I'm a physician associate who specializes in injectables like Botox fillers and biostimulators like Sculptra. And I've seen this happen. I've had patients who come in who are bothered by, let's say,
their 11s, also known as frown lines.
They come in and get Botox, and the Botox worked because it paralyzed their muscles, but they don't understand why their frown lines didn't go away.
The most common areas Botox is used to treat wrinkles to are the glabella, the area of the brow where we have frown lines, and sometimes you also get these smaller horizontal lines as well, the forehead lines, and crow's feet.
I just want to say I'm not trying to scare you into getting Botox. I'm just here to give you the information on when I feel is the best time to start. What you choose to do with the information is your call. If you want to avoid getting wrinkles in these areas, or if you already have forehead lines, crow's feet, and 11s, and you're bothered by them, and you want to know if Botox is going to work, you're going to want to watch this video.
And when I say Botox, I'm also including all the other neuromodulators on the US market: Botox, Dysport, Xeomin, Jeuveau, and Daxxify. So when is the best time to start Botox if you want to avoid this from happening?
So in order to understand when you should start,
you need to understand how wrinkles develop to our upper face.
So when we're younger, we're making facial expressions all the time.
We're raising our brows, frowning, and smiling. The repetitive contraction of our facial muscles cause lines in the skin to form. But these lines or wrinkles are temporary and appear only during facial expression. These are called dynamic wrinkles. But as we get older, the repetitive movement of these muscles start to catch up with us because of the loss of collagen and elastin in the skin. So our wrinkles transition from dynamic wrinkles in motion to static wrinkles at rest. So they stay around even when we're not making those facial expressions. Once they transition from dynamic to static wrinkles at rest, they will start off as mild, then they'll turn to moderately deep, and then very to severely deep wrinkles. Those who have very light skin and hair complexions tend to notice these lines sooner, maybe in their 20s or 30s, and those with darker complexions who sometimes don't notice lines until their late 30s or 40s, and those who have very dark complexions may not notice lines until even older. People who get a lot of sun exposure are going to notice wrinkles sooner, as well as those who have stronger facial muscles.
This is why the age at which people develop wrinkles to their upper face varies significantly, which is why I can't say there's a specific age you as an individual should start Botox. But in general, I think it's a good idea to start
before your wrinkles turn static and moderately to severely deep. So if we look at this wrinkle severity scale, I would recommend you starting before your lines are this deep for glabella lines, before this deep for crow's feet, and before this deep for forehead lines. You don't have to wait for your lines to get this deep, but you should plan on starting Botox or other neuromodulators by the time your lines are around this deep, which is on the lower end of the moderately deep wrinkle scale.
And the reason I say this is because it'll be more difficult to get rid of your wrinkles when they become too etched in.
Because Botox does not work by erasing wrinkles, and it's not a filler that's going to fill out lines. It works to treat your wrinkles by temporarily weakening and paralyzing the muscles that are responsible for contributing to the wrinkles. When your muscles can't contract, the lines soften. So if years go by and your wrinkles fall in between the moderate to severely deep and they're very etched in,
Botox may not work to completely eliminate your wrinkles. And when I have a patient come in and they're on the scale of very moderate to severely deep, I tell them, if we treat you with Botox, don't expect your lines to completely go away. They'll soften up, but you'll probably still have them. Now, You may be thinking, if your lines are already very deep and Botox won't take them away, why would you even get Botox in the first place? Because if you don't get Botox, your lines are going to get even deeper. So if you start Botox and you keep up with it, it'll prevent your lines from getting even deeper. And with time, even though your lines are very etched in, they'll usually tend to soften up because those facial muscles aren't contracting the skin together in the same way. And that brings us to the topic of preventative Botox.
Does preventative Botox work? Can it really prevent wrinkles to our upper face?
Yes, it absolutely can, if you keep up with it. You may view young people who get Botox as image obsessed, but they know and they understand that if they start Botox preventatively, they're likely not going to develop forehead lines, 11s, and crow's feet. But with that being said, I don't personally feel like someone needs to start Botox if their wrinkles haven't turned to static yet. So if your wrinkles are still dynamic and you only see lines when you
Frown, raise your brows, and smile, and at rest you have no lines, there's probably no need to start Botox.
So if you want to get Botox preventatively, you can wait until your lines turn
Static, and they're mild to maybe mild to moderately deep.
and Botox or other neuromodulators should completely eliminate your lines. And if you keep up with your treatments, you'll likely never develop wrinkles to those areas of your upper face.
The term baby Botox was coined for those who want to get ahead and start anti-aging, or for those who have lighter, less defined etched-in lines.
Baby Botox is still the same type of Botox. It only differs in the fact that a smaller dose is injected because you're starting earlier. So you don't tend to need as many units. Instead of using 25 units in an area, you may only use 10.
But you're usually getting treated more frequently.
Maybe around every 2 or 3 months to maintain. The longevity of all neuromodulators is dose dependent. So if you're using less units, you'll usually need to be treated more frequently. And some patients love this because they're making subtle changes and they feel that they have better control over their facial muscles and they have a more natural appearance. If you have deeper lines, you're not going to be able to get away with baby Botox. You're going to need a larger amount of units.
Let's say that your 11s or forehead lines are on the moderate to deep end of the spectrum.
And Botox didn't completely eliminate them. You may be thinking, well, can I just do filler? Some providers will do filler to someone's 11s or forehead lines to try to soften them up if Botox didn't completely take their lines away. But that's a very risky area to treat with filler because of the possible complication of blindness. And in my opinion, the risk of treating your 11s with filler isn't worth the result you're gonna get, because in a lot of cases, when someone's lines are that etched in, filler will only soften the lines up a little bit, but it almost never completely takes their lines away. This is the reason it's important to start early before your lines get too etched in. Botox is the most effective way, and probably even the most cost-effective way, to eliminate 11s, forehead lines, and crow's feet. Don't waste your money and your time on expensive creams. And I also want you to know that I love retinoids and retinols, and I think everyone should be on them if your skin can tolerate it. But it's not going to take away these wrinkles. They'll make the texture of your skin look amazing, but it cannot compete with what Botox or other neuromodulators can do.
There's a reason why Botox is the #1 cosmetic procedure in the world. It's because nothing can compete with it in reducing wrinkles to the upper face, not even beloved retinols or other medical grade skincare.
We also can't ignore the other reason people get Botox. It's not to just eliminate wrinkles. Another reason people love Botox
is because it stops unflattering facial expressions.
And you will understand what I mean if you've gotten Botox or other neuromodulators before. The most bothersome, irritating expression people want to prevent themselves from doing seems to be frowning. People love it when they can't frown anymore. Comment below if you've ever gotten Botox to stop unwanted facial expressions. Let us know what you think.
So how often should you get Botox to prevent wrinkles?
I always tell patients, on average, expect to get treated around every 3 to 4 months. The longest I recommend going is about 4 months, because at 5 months, the muscles are usually in full effect again, so the wrinkles return. So if you want to prevent wrinkles, you should aim to come in before you're completely back to baseline. The glabella and the crow's feet will usually last around 4 to 5 months. And the frontalis muscle, the muscle that gives you the horizontal lines on our forehead, usually comes back sooner than the crow's feet and glabella area. And in a lot of cases, our glabella gets trained to where after treating it consistently for maybe 2 years or more, it can last for quite a while. But you have to be on top of it and consistent with treating it. I've had a lot of people come back and not have to get as many units to their glabella because they were treating their muscle consistently. And after a while, because they didn't use the muscle, it wasn't nearly as strong as it used to be. Let us know what you think. Have you gotten Botox? Would you get Botox? And do you think that young people who get preventative Botox are image obsessed? But don't forget to watch these videos next to learn how you can get ahead of the anti-aging game.